Welcome. So, I'm Dr. Jackie Gardner Nix. This is another episode of our series, Migraine from Both Sides. And I'm here again with Christie Tate, my colleague, who's a nurse practitioner. And we want to use this episode to explore some feedback that we have received after someone viewed the first few episodes of this series. This is a person who volunteers with the Canadian Headache Society, and she was talking about the languaging of migraines because we're transitioning now towards understanding migraines better and changing our perspective on them, changing our languaging. If you change your languaging, you often are looking at something through a different lens. Christy, let me throw it to you.
Sure, I'm happy to speak about this. I think when we talk about migraine, and we had a little bit of a conversation about this. So, it's a neurological condition or a neurological disease or a neurological disorder, depending on how you want to, phrase that. And I think we can kind of dissect some of those terms a little bit and the implications of them. But people live with migraine. We don't cure it. You are a migraine sufferer, and then you have episodes, or sometimes they're referred to as migraine attacks, migraine exacerbations. They can be called different things. These episodes tend to be the most disabling manifestations of your migraine. So it may be the severe headache, the nausea, the light sensitivity, all of those symptoms that go along with it. And if you're somebody who then in between those episodes doesn't have any symptoms, you are still a migraine or a migraine sufferer. So, some of the feedback is saying something like having migraines implies that you sort of have these episodes and in between you don't experience anything. And I think it's quite diminishing for people who are very impacted by by this disease and live most of their days with some symptoms. The interesting thing about the condition, and sometimes I pose this to my patient because it's not my decision to decide, do we call it a disease or a disorder? I think I used to always refer to it as sort of a disorder, and it's a little bit softer, or a condition, a neurological condition. But I have many patients that say they prefer to call it a neurological disease because it calls it out for what it is. It gives it maybe a little bit more validity or power impact of the disabling nature that this can have on their lives. So we did talk a little bit about this back and forth, Jackie, before, but do you want to share some of your thoughts on, disease, disorder, neurological condition, and how that sits with you?
Yes, I think it is seeing it a little through a different lens. I think I have been thinking of myself as having migraines, and that I'm very lucky when I'm between migraines and I'm headache free. But in reality, I know I live with a migraine disorder. That's permanent for me. I'm not curable from that disorder. Some people might prefer to use the word disease, especially if they have it more severely or more frequently, the manifestations. Uh, but what our colleague was saying is it's a little bit like living with multiple sclerosis, like MS, where people know they have MS continually, but they have flare ups, exacerbations, and they manage those exacerbations. And I think that is slightly different than saying, oh, I get migraines. I think it also helps our families to understand it better as well. So to some extent, it might help families to cope with the fact that we have this condition. We manage it the best way we can, but it also allows some manifestations of migraine that aren't typical to maybe become diagnosed. So, at the same time as I received this feedback from our colleague, there was a newspaper link sent to me about a man who had, throughout his lifetime, some profound episodes of fatigue to the point where he couldn't work during those episodes. He would have to go to bed. He couldn't lift an arm. He couldn't focus on a book, and they would last for several hours. And he had gone to many physicians to try and get a diagnosis of what this was. It was like a short form of chronic fatigue syndrome, but it was one he recovered from. And eventually, he did consult with a neurologist who wondered if it was a migraine phenomenon, even though he did not have headaches. And indeed, when he was given migraine treatment, these episodes were able to be vanquished. So he was now looking at his life going forward as being different in that he had an ability to manage some extremely career threatening and family threatening episodes. That I think allows us to maybe expand the scope more of strange phenomena that might occur to people where they don't think of it as a migraine manifestation, and neither does the healthcare professional. But now, with our expanding understanding of the underpinnings of why we have migraine, it might allow more people to achieve a diagnosis if the migraine treatments work for them.
Yeah,
What
I
do you
think
think?
that's a really good point, and it makes me think also of sort of the trajectory or episodes of migraine. So if you sort of look at a textbook and what happens during a migraine attack, there can often be something that's sort of a prodrome phase as well as a postdrome. So the prodrome can go on sometimes for days before the more severe symptoms of the attack. And people will describe things like mood changes and changes to kind of sensory stimulation or more increased sensitivity, sometimes cravings, cognitive changes, all of these things that, when you think of maybe what somebody describes to a healthcare provider, they're not easily sort of quantified. I don't know, maybe it's, chalked up to, are you tired? Are you stressed? But that can go on for a chunk of time. Then I think what's sometimes, appreciated is just that most impactful period of the migraine attack, which for many people is the headache episode, the nausea or light sensitivity, and all those more classically associated symptoms. And then there's this post-drome phase, and sometimes this is referred to as the migraine hangover, where you come out of it, you feel foggy or heavy. There may be some difficulties with cognition or your mood. And so there is this sort of wave. And for some people, they're in some sort of part of this wave almost all the time. So even though what may be captured is that period where it's maybe most profoundly impacted, they're still impacted to some degree at all times. And that's migraine disease or illness. That's what it is. You're living with this happening in your brain at all points, and it manifests in different ways. So sometimes people are very in tune to these things, and they'll say, is it unusual? I noticed that I yawn a lot before, or there are these kinds of things, and they may even sort of discount it. But if you explain this prodrome and postdrome sort of phenomenon, then it's sometimes a aha moment that goes along with it. So it's I think we're trying to say that this is something that people live with to varying degrees of impact all the time and through their life. And there is a way, and we'll talk about this more. How do you live with it in a way that you're not always at odds with it, but you can kind of go with it a little bit more or regain a little bit of control over it?
Yeah, I even prefer to say that I have migraine exacerbations rather than attacks because that feels too much like it's a foe. And honestly, I'm living with this as a collaborator most of the time. Yes, but also we can mention that sometimes these manifestations are without headache, right? I've had the odd time when I've had an aura with the patches of loss of vision where I haven't had a headache directly afterwards. And it has gone on to just simply resolve. It's not many times, but it's happened. Also, pretty much every time I've moved house in the last 10 years, and that's about 4 or 5 times, I've had episodes of vertigo when I've laid down. And I think that was a migraine phenomena. And also, I remember having quite an extreme episode of stress once, probably around 2008. when I got in the shower shortly after, and the water on my skin felt different. And that actually lasted for several weeks. And I did consult with neurologists thinking I had MS potentially. I did have an MRI. And we decided it was kind of a form of Bell's palsy that was a stress reaction. And looking back on it, it may have been a migraine phenomenon. And it did recur a few years later on another extreme stress where I had patchy loss or change in sensation over the legs. So for me, these unexplained things where, yes, I had appropriate tests and so on that showed nothing, may have just contributed to saying these are varieties of migraine phenomena for me. I think they should always be investigated and not just put down to migraines every time. But it's kind of reassuring to realize, for me, that strange things happen under stressful circumstances that are reversible and that aren't necessarily going to bring forth a more catastrophic diagnosis.
Yeah, and you sort of made me think of another interesting kind of feature that seems to be with migraine, and I don't know if you've experienced this, but they've evolved for me over the course of my life, and certain symptoms that go along with them have become, more or less pronounced over time. And one thing that has certainly started to become a more pronounced feature in the last, maybe decade, is some vertigo or vestibular symptoms. So I'm far more sensitive to motion and things like this, and that can sort of be associated with my migraine attacks, or can almost sometimes trigger them or be a part of them. That really wasn't a feature, I think, when I was in my teens or 20s living with migraine. So we we gather certain things along the way. I've heard some patients say, maybe the severity of their attacks have gone down over the course of their life, but the frequency may have gone up. So they're living with more frequent and regular degrees of pain, with increases in the severity, but maybe not as, profound an attack, or things like nausea may or may not be a part of your migraine attacks at different times. Have you noticed any kind of evolution in the symptoms of your migraine episodes over the years?
Difficult to difficult to tell because I've been on preventative since 2017, and that definitely brought down the frequency and the severity of the attacks as well. But I do know that in the literature, as we age, we may get some of the auras without pain. So sometimes that can go in a nice positive direction, apart from the fact that you do not want to be caught with an aura that causes visual disturbance if you are trying to get somewhere, or if you're out and about, you're trying to safely return home. Pulling over to the side of the road is something I have done a few times and waited things out. So, yeah, I find it very interesting to really look at how we regard our acquaintance with migraines. I won't go so far as to say it's a friendship with migraines, but a collaboration with migraines, or being a sufferer, or living with migraines. I think I prefer to express it for myself as living with migraine. That's how I would look at it. And that then allows me more scope to explain some of the strange things that I do notice that may be associated. And let's hope too that healthcare professionals have a bigger scope of understanding of migraines so that the diagnoses are made more frequently, appropriately. Okay, let's leave it there. That was an interesting discussion and may give people a lot to think about. Certainly did me.